Hello everyone, this is Dr. Fadi Asim. I'm an OET instructor. In our session today, we will talk about the occupational English test. In our session, we will talk about the different test parts and also about our course. In the first section of our session, we will discuss these topics. Let's start with the writing subtest of the OET exam. The writing subtest will be in the form of medical case notes, and the aim of the test is to convert these medical case notes into a formal English letter. It might be a referral letter, discharge letter, transfer letter, or any other letters. The word count should be between 180 and 200 words. The duration of the writing subtest is 45 minutes. So you are given the case notes for 5 minutes to read it, and then you are allowed to write your letter in 40 minutes. Throughout the writing subtest, you will be having the case notes with you. The desired score that you have to reach to pass the writing subtest should be 350 or more. This is a sample from the medical case notes that you are given in the writing subtest to convert it to a formal English letter. Your writing subtest then will be, the letter that you have written will be assessed by assessor in Australia according to their assessment criteria. It's essential that your letter has covered the purpose, the content, the conciseness and the clarity of the information that you have selected. Genre and style of your letter is essential, and the organization and the layout of your letter's paragraphs. And lastly, the linguistic features or the language. The linguistic features or the language includes spelling, vocabulary, and also grammar mistakes. So I consider it the most important part of the assessment criteria. Then we move to the speaking subtest. The speaking subtest will be in the form of 2 role-play cards. Speaking subtests start by a warm-up conversation between you and the examiner, and then you are given a role-play card. The role-play card will be you will be given 3 minutes to prepare this role-play card, and then the examiner will hold a conversation with you to cover the points in the role-play card. In this situation, you will be taking the professional role as a doctor, dentist, or nurse, and the examiner will be the patient. It's essential to know that body language and facial expression aren't that important in our test because the conversation between you and the examiner is recorded and will be assessed in Australia. To pass the speaking subtest, you have to get a score of 350 or more. And here we have a sample from the role-play card that you will be preparing and discussing with the examiner. And it's essential to say that your conversation with the examiner will be assessed as well according to certain assessment criteria that they have put. This assessment criteria covers not only the linguistic features or the linguistic criteria of your conversation, but also it covers how you communicate with the patient in a professional way. Let's move to the listening subtest. In the listening subtest, it's divided into 3 parts. The total number of questions in the listening subtest are 42 questions. To pass the listening subtest, you have to get score of 350 or more, and its duration is 40 minutes. It's essential to know that the recording is played once only, so you have to write and answer while listening. This is part A of the listening subtest. It's formed from 2 consultations. The total marks are 24 marks. And this is part B, 6 marks, which are 6 different recordings. Each one is followed by a multiple choice question. And part C are 2 long articles, or 2 long, recordings. So you have to answer them while you are listening to the recording, and each one of them is followed by 6 multiple choice questions. So the total number of marks are 12 marks. The reading subtest. The reading subtest also is formed from 3 parts, A, B, and C. The total number of questions are 42 questions, as we mentioned in the listening subtest. The duration of the reading subtest is 60 minutes. It's divided into 2 sections. In the first section, part A, 15 minutes. So you have to answer part A in 15 minutes, and then you have to answer part B and C in 45 minutes. The target score to reach is 350 or more. To reach this score, you have to get 30 correct answer out of the 42 questions. This is a sample that we can see from reading part A. So we have 20 questions that have to be answered in 15 minutes. So it's a matter of time. You have to manage your time well to pass part A. Part B. Part B are 6 separated short texts. Each one of them is followed by a multiple choice questions, as we can see in the sample in front of us. Then we move to part C. Part C are 2 long healthcare articles. Each one of them is followed by 8 multiple choice questions. So part B and C, both of them should be finished by 45 minutes. So it's important that this part assess how you interpret what you read. Okay, let's now come to a different question. What is it required for? Actually, OET exam now is important in doing registration in different countries, like in the UK, Australia, and also it's important to do some tests like PLAB test. So you have to do OET first. And recently, it's been used to apply for a visa, especially when you are going to UK. So if you have an OET exam, you can use it for getting the GMC registration, and then for applying for a job using the Tier 2 visa. Okay, how much is a OET exam? OET exam booking is only online from their official website. So you have to pay like $7 Australian to establish an account, and then $587 Australian dollars. These are the test fees. However, nowadays they are having like group discounts that might reach up to 30%. The test is held every month and sometimes twice a month. The validity of the OET test is 2 years. Okay, where can someone take the OET exam? There are different test venues in different countries, like in Australia, England, Pakistan, India, Egypt, Dubai, Saudi Arabia, and other countries. So you have to check the website for the availability of OET test venue in your country. However, starting from the 27th of June 2020, there will be a chance to take the OET exam on computers. So it won't be only paper-based test, but it will be available also as a computer-based test. And also it will be available to take the OET exam from home. from your own PC. And this is a good chance for countries where there is no exam venues. However, the information available for the computer-based OET and the OET at home are still scarce. If you have any questions concerning the OET test, please ask me. And now we can move on to the course. These are the topics that we are going to cover in the next part of our session. So the writing sessions in our course will cover most of the topics that's needed to pass the writing subtest. So we will take you from the scratch how to write a letter, what are the important grammar parts that you need to include in your letter, what are the different forms of sentences concerning simple, passive, complex, compound sentences, and how to write them, how to avoid the common mistakes and the medical jargon that people usually fall in while writing the OET letters. And also we have live letter correction sessions to check how well and how ready are you for the official OET test. In the speaking sessions, we will do the role play cards one-to-one. You will be given a detailed feedback about on your performance on the different role play cards. And also we tackle difficult situations like how to deal with an angry patient, how to deal with a reluctant patient, how to deal with emergency situation, breaking bad news, like how to tell someone he's having cancer, for example. Now we come to the reading sessions in our course. In the reading sessions in our course, we will give you ways to approach the reading parts A, B, and C. We will do like live discussion on the reading questions. All the needed tips and tricks of the reading subtest will be provided to you. The course attendees will participate in solving different questions. And the same course will be applied to the listening subtest. You will be given all the needed ways to approach the listening subtest. You will be given all the tips and tricks needed to pass the listening subtest of your official OET exam. So we come to a different question. What's different about our course? Actually, there are different points that we need to hit in this question. First of all, our course sessions are live sessions. They are held on Zoom application, and all the course session will be recorded, so you can listen to the session one more time if you couldn't attend. Also, once you join the course, you will be added to an active study group on WhatsApp and on Telegram, so you will have chance to participate and share your knowledge with others. Also, all the required study and practice material will be sent to you. And also, every other month, we do a mock test. So the mock test will be like the exam situation exactly. So it will make you feel comfortable once you get into the exam situation. All right, so our course cover all the subtests of the OET exam. Our session of speaking are really useful because they train you on different role play cards. Also, a study plan will be sent to you to put you on track while preparing for the OET test. Letter correction homework will be sent to you so you can do the homework, and then your homework will be corrected to know where you stand from the exam. The duration of the course usually 1.5 months, plus there will be revision sessions before your actual exam date. All right, you can book the course now and booking online for the course is available, and there will be special offer for groups. This is part from the exam, from the OET material that can be sent to you once you join the course. And here are my contacts. Feel free to contact me at any time, and best of luck. Thank you so much.